Today I would like to talk regarding the effect of fasting on the pregnant women, and when we are allowed to be fasting and when we have to break our fasting. Regarding the pregnancy in general, the first trimester and the third trimester, they are considered relatively a risk period during the pregnancy. If the pregnant lady in the first trimester has excessive vomiting, nausea, cannot tolerate the oral fluid or any signs of dehydration, at this moment we cannot permit fasting because she needs to be well hydrated. She should take at least 3 liters per day. Also during the last 3 months, usually the fasting will affect the baby movement and the energy requirements of the baby. So if the female noticed any decrease in the fetal movement during fasting time, she have to break her fasting. But regarding the second trimester, 4th, 5th and 6th months, it's considered relatively a safe period if female want to be fasting. If she will be fasting, she has to take at least 3 liters during the iftar time. And she should break her fasting on something like date and juice. Then after half an hour she can take the salad and protein. Then after half an hour she can take the rest of her meal. So we are advising generally the pregnant female, if she will fast, she can take the iftar meal over the 2 hours, and the same for the suhoor meal as well. Because if she is fasting for a long time, more than 12 hours, and she takes a heavy meal, this will disturb the stomach, and she will feel headache and abdominal pain and some nausea and vomiting. Some cases they are not allowed of fasting during the Ramadan because they are high risk, like if the woman has diabetes with pregnancy, or has hypertension with pregnancy, or has multiple pregnancy like twins. All these conditions are considered a high risk pregnancy, and fasting is not allowed because of regular medications that she has to use all through the daytime. So each condition or each pregnant lady is considered a unique per herself. And before the decision to be fasting or no, she has to visit her doctor, and he is the one who will assess her general condition and advise on fasting or advise against fasting. Another thing that I would like to add, if you decided to fast and during the daytime you feel that headache or dizziness or a loss of consciousness, you have to break your fasting immediately. You should revisit your doctor, because maybe the fasting has adverse effect on your body, and you have to be re-evaluated again by your physician. And finally, I would like to emphasize that the Islamic rules exempted the pregnant women from fasting in all the trimester. In any time of the pregnancy, you have the license to break your fasting if this affecting you or your baby. Thank you very much, and I wish you all the best during Ramadan time.